Hey guys, I'm here at Dr Divya Skin and Hair Solutions and I'm here with my lot of questions, so check it out. So ma'am, my first query will be, what are the common skin and hair concerns that are faced in PCOS patients?
So in PCOS, what we need to understand is that PCOS is not just irregular periods or irregular cycles. PCOS is a syndrome. It's a constellation of signs and symptoms. So whatever we eat in our body is absorbed ultimately into glucose, detecting which your body secretes insulin. So in PCOS, what happens is that as the glucose load goes up, your insulin is rising proportionately, but the quality is not getting good. So we call this as insulin resistance. So this high insulin level, it causes pigment formation in the skin. So patient can have a lot of pigmentation, especially on the forehead, under eye, even underarms and private areas. Then the patient may have breakouts or acne after 25 years of age. You know, they will always come and complain of thinning of hair in the central part.
Exactly.
And the same insulin it also acts on your ovaries, causes irregular cycles. It increases the male hormone, and they may complain of hair growth on chin, beard, center of chest, upper part of abdomen. So all this is because of dysregulation of insulin. So starting from your acne to your pigmentation to your breakouts to your hair fall, hair loss I would say, and abnormal hair growth of the face is what we generally get to see.
So my second query will be, is female pattern hair loss caused due to PCOS reversible, and if yes, what are the treatment options?
The increased insulin level basically decreases the growth phase of the hair. So patient may or may not have hair fall, but over a period of time, hair has a cycle. Hair has a growth phase and then it has a telogen phase, and every 3 months we actually regain a new hair cycle. But mostly 80% of the hair is growing, so we don't get to see it. In PCOS, the insulin is decreasing that growth phase. So old hair goes, but new hairs are coming thin, and over a period of time there is sometimes widening of the central parting of the forehead. Most important is that as soon as you see the first sign, please go to your dermatologist and treat it. Do not waste your time with home remedies. And we have to understand there is a basis, hormonal basis to it, which needs to be taken care in order to retain. Now there are also therapies like we can give them topical minoxidil. We also sometimes use topical anti-androgens. We may give them oral anti-androgens. We also take help of certain procedures. So whatever little potential the follicle has, we try to maximize it out by using growth factor treatments like mesotherapy is there. We use low level laser therapy. We use platelet rich fibrin in my center. So that would help you to regain your mane. But most important thing is, go at the earliest. Don't waste your time. The thinning is not going to get reversed by application of a shampoo or an oil or a lotion. So you should take an expert advice, and definitely I would say to some extent it is very much reversible. It may take a little longer than males, but we have seen encouraging results with procedures as well.
So ma'am, can you please elaborate on the treatments to address the facial hair growth? And I heard laser helps that. So how is that?
Generally, women with polycystic ovarian syndrome or PCOS get excessive facial hair, and going to parlors every week or threading or various ways of hair removal are actually not decreasing your hair. So laser hair removal actually helps in permanent reduction of those thick and coarse growth up to 90%. Of course, patient has to undergo the treatment as well as take appropriate lifestyle measures to prevent more growth. I find laser hair removal very, very helpful in patients who are suffering from hormonal imbalance. It is a completely safe approach to remove hairs. So I am using the gold standard diode all across the world, luminous light sheer desire with 2 handpieces. It's a safe procedure. It helps you in reduction of the thick, coarse hair growth, and I can boast of very good results in just 6 to 8 sessions. So here I have a patient who is battling with PCOS, and she's in the last of her sessions, and I can see tremendous improvement. You can see it's very, very comfortable. So what we basically do is we pass the you're comfortable, and that's it. So a lot of PCOS patients complain of resistant dandruff and hair loss. Now, hair loss would require a prescription like a minoxidil and oral anti-androgens and insulin sensitizers. We also use the same red wavelength in a higher dosage for stimulating the blood circulation to the hair follicle. It also takes care of the flakiness of your scalp, and I also use it a lot for my dry and frizzy hair patients because it actually, the light improves the circulation to the follicle. Patient can actually see an improvement in the texture of the hair as well. So we also use, generally you must have heard about platelet-rich plasma, which is used to regenerate the hair follicles, to regrow the hair follicles. In my center, we use injectable PRF. We use a German syringe, which comes by the name of. So we have a special centrifuge. It is a single spin centrifuge method. We employ the world's best PRF syringe. So we use a double syringe which we source from Arthrex, Germany. The centrifuge also comes along with it. It's a single spin centrifugation. We get injectable fibrin which we inject into the roots of the hair growth to give them a new lease of life. Our center is one of the first centers in India to bring this technology to the world. It is those PRF where we do not employ normal tubes. This is the first PRF which is approved for human use, and there is no biochemical alteration, not even a clotting agent is added when we prepare your PRF. And we're seeing excellent results when it comes to regrowth of lost hair or to improve hair thinning in female pattern hair loss. So patients should also make a conscious effort to reduce their stress levels, and stressing it out is not good. Sweating it out is definitely good for PCOS. So you might require help from a gynecologist or an endocrinologist to regularize hormones and to work on insulin. But no matter what we do, I always say, PCOS treatment is just like the tip of the iceberg. 80% effort comes from the exercise and the diet and the lifestyle. They have it on a daily basis. So it's very, very important to manage
everything. Definitely. Thank you, ma'am, and for your lot of suggestions and the treatments, and pleasure meeting you and getting all my questions answered.
I can't tell you the thrill I had. It was a very nice conversation, and I think PCOS is one thing where people seem to talk a lot about, but very few people actually realize it's a metabolic issue. It's not a hormonal issue.